Recent statistics suggest that 1 in 58 Americans are likely to develop a melanoma sometime in our lifetime.
When you look at the number of years of lives lost to cancer, melanoma is second only to breast cancer.
It's normally a silent, asymptomatic growth, causing no symptoms and little to get the patient's attention.
If we diagnose a melanoma early on, we can cure it. And if we diagnose it a couple months later, then we have to tell the patients we don't have a great treatment for them.
If tumors are neglected or not recognized, cure rate is way down in 5 years to about 15%.
Considering that it's a 3 millimeter, 4 millimeter, 6 millimeter mole can lead to death is frightening. It's aggressive.
Well, I think what dermatologists have to do today is cut everything and perform biopsies on everything which is suspicious, because there is no better tool than the doctor's eye.
Well, we're not perfect in detecting a melanoma by visual examination or by some of the current techniques that we use, such as dermoscopy, and therefore we tend to over-biopsy.
There are studies that show that physicians might biopsy 30 benign lesions for every melanoma that they diagnose.
There remains risk if the tissue sampled doesn't happen to be representative of the worst part of a lesion, and it's possible that that melanoma may not be diagnosed.
We have tried to develop ways to help people have greater specificity in their diagnostic abilities, but we're still not doing a good enough job, and we need help.
Several years ago, I heard about an idea that you might be able to put a piece of tape on your skin and collect genetic information that could detect disease. It seemed awfully far-fetched, but today we have a product that can do exactly that.
So with the DermTech technology, a tape is applied to the suspicious mole. And when peeled, it removes the genetic material that gets sent to the laboratory. The RNA is collected in the laboratory and is analyzed by a technique called gene expression profiling.
So what's shown here is something that we term a heat map. And it's a display of the data showing all the samples that have been collected using the non-invasive tape stripping technology. The blue bar represents benign lesions. The yellow, the lesions with melanoma. The blue bars interdigitating the yellow are the lesions that are benign, as called by two different pathologists.
I recall one patient, in examining him, I detected a suspicious-looking pigmented lesion on his back that he had not seen, was not aware of, and it happened to occur at a time when we were doing the tape stripping study, and he consented to be included in that. We removed his lesion as we normally would, and the pathology on those sections I interpreted as a benign mole, and didn't think much more about it. He had no further treatment. When contacted from DermTech, that their genetic analysis of that patient's sections and tape study were more consistent with melanoma.
This would suggest that we may actually be more sensitive than the current gold standard of microscopic pathology. More intriguing is the possibility that what we're actually seeing are genetic changes that predate any change in cellular architecture that would be present in the mole, and that these early changes that we're picking up may actually detect the melanoma before we can truly see the malignant cells appear.
The U.S. government has clearly recognized the importance of genomics being applied to detection tools and has strongly encouraged the development of such products. Ours is the only one that is genomically based, which is on the verge of being commercialized, which can tackle the question of whether someone does or does not have melanoma.
We're seeing 100% sensitivity. We don't miss anything. And our specificity is 88%. Let's call it 85% to be conservative. So we're markedly better than anything that's now out there.
An estimated 1 in 50 Americans will develop melanoma at some point in their lives. Now, the usual routine, as you may know, is a doctor finds a suspicious mole or a lesion on your skin, removes a little bit of it surgically, and it's biopsied. The test developed by DermTech means no scalpel, no cutting.
I'm just going to move this over the mole.
It's this simple. Instead of removing any skin surgically, the test involves using a custom adhesive to remove cells from the skin. Those cells are then tested for melanoma.
It's very exciting.
Dermatologist Dr. Robert Scheinberg was involved in the study, which detected melanoma 100% of the time with 12% false positives. Kendra Souza has had melanoma and roughly 40 biopsies. She likes this better.
It's so much easier. It felt like an eraser, just an eraser rubbing over your skin.
Dr. Scheinberg thinks fewer scalpels will mean more people willing to get tested.
If they see a mole that's changing a little bit, they won't be afraid to come in, and so we'll be able to diagnose them earlier.
And early detection is the key.
And to know that all you're going to do is have a little bit of tape put over you, a lot of those people will come in.
Melanoma accounts for only 4% of skin cancers, but 80% of skin cancer deaths.